So what is a prostate gland? A prostate gland is an organ involved in the reproductive system. It's a part of the urinary system. It has reproductive functions and it is present below the bladder, under the bladder, and the urine passes through the prostate to the outside. The prostate is also important because the seminal pathway, that is the path of the semen, also comes through the prostate and into the urinary passage. So how can one find out if he has a prostate problem? Usually by the symptoms. A prostate problem causes a person to pass more urine, to pass it in small quantities or pass it in slower stream. He may have difficulty in emptying his bladder completely. He may have a frequent urination. He may be forced to urgently go for urination, which may be socially sometimes inappropriate. And in worst cases, you can also have a leakage of urine into the clothes before he reaches the bathroom, which is called urgent continence. Along with this, he may have blood in the urine or pain when he has intercourse, and also some pain underneath the testis. So these are in broadly the symptoms of a prostate gland. So what are the age groups who can get affected by the prostate problem? In the young people, usually in their 30s to 40s, this infection associated with inflammation, which can cause which is called prostatitis, which can be either acute or chronic. In the older age group who are above 55, they can have a prostate growth, which is called the benign prostatic hyperplasia, or it can be a cancerous growth, in which case it's called prostatic adenocarcinoma. So these are the various diseases that can happen. So after the symptoms, if you have these kind of symptoms, we can find out that one person has a prostate problem. So how do we diagnose a prostate problem apart from the symptoms? We can do investigations which is basic, which is like ultrasound abdomen. We can do urine routine examination. We can do a blood investigation called total PSA if there is doubt of prostate cancer. And of course, last but not the least, clinical examination, which involves a per-rectal examination of the prostate. So treatment can be broadly classified as medical or surgical. Medical management is usually more for the infection and inflammation related, where you may have long-term antibiotics and with alpha blockers. Those with BPH, which is benign prostatic hyperplasia, most of them usually have medical therapy in the form of alpha blockers with or without dutasteride. Surgery particularly comes in when the prostate gland is very large and it's not amenable to medical therapy, or the patient is having clear-cut urinary obstruction, or the patient has gone into retention of urine, which a very large gland. A retention can have sometimes medical therapy, but if it fails, then obviously surgical therapy is required. Surgical therapy can either be endoscopic or open surgery depending on the size of the prostate. Today, with the advancement of technology, endoscopic surgeries are the norm. Open surgeries are done in quite rare situations unless until other indications are associated, like associated bladder calculi. Now, can the prostate problem recur? Is the question which I usually face from patients. Yes, in some instances, if the proper treatment was not taken completely, if the patient has left off the treatment after a little improvement in case of infections or inflammations, or the patient has actually undergone a surgery and after 10 years the prostate regrows for a benign prostatic hyperplasia, in which case he may have a recurrence of symptoms. Prostate cancer is curable in early stages, but prostate cancer in advanced stages is not curable, but it can be brought into remission with excellent control with a good life expectancy of at least 2 to 3 years even in advanced metastatic disease. So this is in a nutshell about the prostate diseases which can be involved. So depending on the symptoms that you have, you may consult a urologist and appropriate investigations can be done. And the treatment, the prognosis of prostate problems is quite good actually if the treatment is adhered to in proper sense. Thank you.